Good afternoon, world. Tommy Jordan here, coming to you on the afternoon of March 24th, 2020. Want to cover some updates about COVID-19. This really applies to my area of North Carolina. The information will eventually be good for everywhere. Maybe it already is for you, maybe it's not. But it's important you pay attention here because it's going to sound like what I'm telling you is different than what I've been telling you. That's because it is, because information has changed. So this is a nice little flyer that the Department of Health and Human Services for North Carolina has been sending out to all the health departments. And I am trying to help do my part by spreading the word for those of you at home because, again, it's different than what you've read before. So I'll try to make it quick. Bear with me, okay? Why things are changing. So you guys heard in the beginning, if you feel sick, if you've been around somebody sick, go home for 2 weeks, don't come out of the house, bury your face in the toilet and breathe deep, whatever. You've also heard to call your doctor, go to the doctor and get tested. That is kind of a phase one, okay? When the hope for containment is still there, that's the goal. Get people to detect early and isolate them and stop this virus in its tracks before it can spread. That's option one. We knew, the health world, the health department knew, the CDC knew, the states knew, I knew, most of you out there smart enough should know, containment was never going to work. Our country is too big and our policy, our desire to have our independent freedoms is too strong. We're never going to listen to health officials enough for containment to do its job. But the whole goal of containment was to slow it down, to stop the virus from flooding our health departments and our hospitals. That's still the goal. However, we're going to move on as a state and for us as a county and mostly in a lot of places as a nation, depending on what state you're in, from containment to mitigation. Okay, so it's like, here's step one of this battle. The frontline troops are done. Now we're going to go to the second line, okay? And the second line is you changing your tactics at home, okay? Your tactics are going to be different. So now, I'll just read off this. I'll paraphrase, but I'll read it so you know I'm not making this stuff up, all right? Most people that get COVID-19 are going to recover without medical assistance, all right? I'm 42. I'm in my 40s. I'm healthy, probably, 40s, 50s, 30s, all of us are probably going to be fine without medical help. If we get COVID-19, what do? Stay home. If you, just go home and cut your grass and do all the things that your fever allows you to do, but don't go out and infect people, all right? So the CDC recommends you stay home if you have mild symptoms such as fever and cough without shortness of breath or difficulty breathing. Of course, if you can't breathe, call the doctor. You need to go somewhere. Some people are at higher risk if they're 65 years or older, if you live in the nursing home or long-term care facility, if you have a high-risk condition including chronic lung disease, severe asthma, heart disease with complications, compromised immune systems, severe obesity with a BMI of 40 or higher, and other conditions such as diabetes and other things. So, if you have the following symptoms, call your doctor right away. It did not say get in a car and go to the hospital. It didn't say get in the car and go to urgent care. It didn't say call 911 and ask the ambulance to take your butt down to the doctor's office. No. What this is going to say is call 911 if you have a shortness of breath, chest pain or pressure, blue lips, that's just a bad sign, difficulty breathing, or confusion. Okay? If you got those things, call 911 and call them quick. If you don't have those things, stay home. Treat it like the cold/flu that it is, okay? Most people don't need a test. Here's the thing. If you got it, who cares? Do you feel better knowing you got it or didn't get it? I had the cold or I had the flu. I don't care what one you call it. I don't care what it was. I care that it lasted 3 days and then I felt better and I go on about my business. Testing centers are not able, nor do they want to go testing every single American that is not going to need a test. If I get tested, I'm 40 years old. It doesn't matter if I get it. If I get it, I'll get over it. If I don't get it, I'll get over it. Okay, don't test me. It's a waste of resources. It's a waste of that line of people that really need to get tested, like my mother who may be 72, or that diabetic person, that person with lung cancer, or the immunocompromised person that needs that test to be sure how their treatment is going to progress. I'm healthy, all right, for the most part. I lose about 20 pounds, but otherwise I'm healthy. I don't have to get tested. Most of you out there don't have to get tested. Stop calling 911 and asking to get tested. And here's another thing. Stop calling 911 in our county. I know because this scanner right here picks you up when you do it. Stop calling, and I'm telling you this from the health department. Stop calling 911 and asking somebody to drive your butt to the hospital to get tested. We don't have enough ambulances for that, okay? If all of a sudden everybody's like, well, I got the vapors. I got to go to the hospital, y'all. Somebody got to take me to the doctor. Lord of Jesus, somebody called an ambulance. What have you done the rest of your life? You got in the car and drove yourself. Why you got to call 911 now? You just got a cold. Stay home. All right? Stay home. Feel better. If you're older, if you're compromised, call your doctor. I didn't say get in an ambulance. I didn't say get in the car. Call your doctor. They will ask you some questions. They will tell you what they want you to do. Do not flood hospitals. Do not flood urgent cares. Do not flood doctor's offices. Do not flood private practice. Why? One, they don't have the room to handle you. Two, they don't have the room to handle you or the time to handle you. Let them focus on people that really need it, okay? Most people don't need a test. If you leave home, you could expose yourself to COVID-19 if you don't already have it. If you do have it, you can give it to someone else who's high risk. Duh. Your doctor can help you decide if there's a test. There is no treatment, so what good's the test going to do? Nothing. You just get the pleasure of going, I was right, I got the COVID. Testing is most important for people who are seriously ill in the hospital, people in high-risk settings like nursing homes or long-term care facilities, and healthcare workers and other first responders caring for people with COVID-19. So don't go to the doctor. I mean, all that's right here. It's right here. And I'll put a link to this on the YouTube video and on my Facebook page. So I'm not making this up. The new rule, the new strategy for us to, as soldiers in this little war, is don't go to the doctor. Not unless he tells you to. Stay home, isolate. Okay? Let me see. This is important. When can I go back to my normal activities? This is good, because now, remember, the old story was go home, spend 14 days, and don't come out and let us see your face. Now, when can I go back to work? Or can I go back out in the public? Or can I go back out and see people? Real simple. You can stop isolating yourself when you answer yes to the 3 questions below. Has it been 7 days since your first symptoms? Your fever, your coughing. Okay, well, yes. Have you been without fever for 3 days or 72 hours without medicine? No taking Robitussin or something to break the fever. Have you been fever-free on your own with no help for 3 days? And are your other symptoms improved? So has the cough gone away? There's, whatever. In other words, if you haven't been sick and don't feel sick for 3 days, you're no longer carrying it. You're okay. You can go out and go back to work. In fact, your employer probably needs you. What if I'm not sure if I have it? If you have fever and cough and other symptoms of respiratory illness, even if it's not from COVID-19, you should isolate yourself as if you have COVID-19. It'll reduce the risk of making other people around you sick. That's common sense. If you do just have the cold, well, good. Don't give someone that's got COVID-19 the cold on top of it. So stay home and isolate yourself. What should my family members do? Good question. Anyone in your household or others that have been in close contact with you should stay home for 14 days because they're just starting their cycle. Close contact means within 6 feet for 10 minutes or more. If they start having symptoms, they take the same steps as you. They have symptoms, great. It means I'm almost through this thing. You deal with your 3 days of flu, your 4 days of flu and cough and cold. You get it past you. You wait for 3 days of no symptoms, and then you go back to work. How many days do you need to wait before you go back to work? 3. If you've had no fever, no nothing, no symptoms for 3 days without drugs, okay, on your own, on your little precious self, all by your muscles and your body with no drugs, all on your own, you feel better for 3 days, you can rejoin society. We want you to. We need you to. All right? Stay informed. DHHS.gov. That's Department of Health and Human Services.gov/coronavirus. All right? If you have any questions, ask them in the video. Ask them in the comments below on Facebook or on YouTube. All right? New rules, new phase of the game. Get the game! That's an EA Sports thing. Sorry, GameStop. You're closed. Bye, y'all.